Hello, my name is Dr. Ruth Edwards. I'm sorry I can't be there today. However, I'm delighted to have the opportunity to say a few words about the IMgateway resource and how vitally important it is and has been in my clinical practice and in the clinical practice of my colleagues when I'm seeing patients, and how important it is to community health in general. Every day in my clinic, I talk to patients about what medications they're taking, what complementary medicines they're taking, and at least in my experience, more than 2 out of 3 of every patient is taking some form of complementary medicine every day. This poses an important challenge for us as clinicians, both in general practice and in the hospital setting, because it's very important to know whether there are any interactions, not just between drugs and other drugs, but between herbs, vitamins, minerals, any complementary medicine, and even in fact certain foods and medications that the patient might be taking. Last week I saw a young teenager who was 17, and she was seeing me because she'd become pregnant. And I looked at what she was taking. She was on the contraceptive pill and she had no idea how this would have happened. And then I noticed that she had been starting to take St John's wort about 2 months before, and that had actually affected the effectiveness of the contraceptive pill and made the contraceptive pill ineffective. Another common interaction is many of my patients are on blood pressure medication, and they're not aware that with certain blood pressure medication there's an interaction with orange juice. So many patients, they swallow their blood pressure tablet and they wash it down with some orange juice, and it's actually really impairing the effectiveness of that medication. The IMgateway resource is one that I trust because it's been peer reviewed by a group of professionals at the University of Sydney, the Department of Pharmacy, and it's thoroughly researched and referenced. And to me, as a clinician and a medical practitioner, that's vitally important to know that the resource is safe and reliable. On top of that, I know that it's constantly updated every day for new information and that it's updated in real time. I can't imagine how much more difficult my practice would be if I didn't have this resource available on my desktop with my existing resources and systems. I have it accessible in the room when I'm seeing the patients, and it has just made my practice much easier and the life of my patients much safer. Thank you.